everyone. I would like to introduce you to my guest today. Her name is Julie Tupler. So Julie, she's an inventor of Tupler Technique, and she runs Diastasis Rehab. So Tupler Technique is the only research-based program to treat diastasis recti, which is separation of abdominal muscles. So Julie, she's a nurse. She's a registered nurse. She's a certified personal trainer and certified childbirth educator. She developed, multiple programs, Maternal Fitness Program, and she's been teaching Tupler Technique for over 20 years. She's been featured in different magazines and different articles, and her research was done at Columbia University. So hello, Julie.
Hello, how are you, Dimitri?
Yeah, thank you for joining me today. So tell us more about Tupler Technique. And I found out about Tupler Technique through a mutual friend, Catherine Indonesia, that took a course with Julie in Tupler Technique. She's in New York. And that's how I first heard about the program that she offers and the technique itself.
So first of all, I want to thank you for having me, because I'm always interested in bringing awareness to this condition called diastasis recti, which is a separation of your abdominal muscles. And most people have it and just don't know it. And the reason that I speak at different events and go on podcasts is because I want to bring diastasis awareness, because my goal is that every belly should be checked as part of any medical or fitness evaluation. When the muscles separate, they're not doing their job of supporting the back and supporting the organs. So the side effects are bloating after eating, constipation with the GI effects with the separating muscles because the connective tissue stretches sideways, back and hip pain, pelvic floor issues, poor posture, umbilical hernia. Separated muscles can put a pregnant woman at risk for a C-section. Separated muscles can also put a patient having abdominal surgery at risk for an incisional hernia, meaning the stitches come undone after the surgery. So I'm wanting the medical community to connect the dots between separated muscles and all these conditions.
Mm-hmm.
And so
Very
that's
good.
what a diastasis is.
Makes sense. Okay. And so Julie, so tell us, so there's different programs. So you offer different programs for the patients as well as for different clinicians. Is that correct?
That's correct. So initially I was just teaching to the general public. I teach to men, women, and children, and also pregnant women. And then these professionals were taking my program personally and said, oh my God, this is so wonderful, I want to teach it. So in 2009, I developed a Tupler Technique professional training program and train medical and fitness professionals all over the world. So they either add it to their practice or create a new practice just with this niche of diastasis, because with diastasis, you can treat men, women, and children. You can work with the pregnant population, teaching them how to prepare for labor, teaching them how to push with their abdominals and relax the pelvic floor so they don't end up with side effects like prolapse, incontinence, hemorrhoids. These can be avoided. And also you can work with pre-surgical patients to, just like preparing for shoulder surgery or knee surgery, it's important to prepare for abdominal surgery because you use your abdominal muscles with every move you make and with every breath you take. And doctors will tell you after abdominal surgery, don't lift anything over 5 pounds. So if I go from a seated position to a standing position, I'm lifting my whole body weight. If I don't know how to use my abdominals, then it's going to put force on those stitches and they're going to come undone. So it's very important to prepare for abdominal surgery to make the connective tissue stronger so it's easier to sew and you don't need mesh, and so that the patient knows how to use their abdominals in the recovery process to maintain the integrity of the suture. So any of these areas my program works well with. So You can, again, add this program to your practice, or just have a practice with just doing this, and would probably be very
Got it.
successful, because my program is not only services, but I have products that go with the services. I have developed a Diastasis Rehab Splint, the purpose of which is to approximate or reposition the separated muscles, and also put the connective tissue in a narrow position, taking the stretch off of it. So that's the Diastasis Rehab Splint. I have developed a diastometer for measuring diastasis, measuring the distance between the separated muscles and the condition of the connective tissue. I've written 3 books on the topics: Maternal Fitness, Lose Your Mummy Tummy, and my latest one is Together Tummy, which is now on ebook. I've produced 5 videos: Lose Your Mummy Tummy, Say Goodbye to Your Gut Guys, Belly Button Boogie, Ab Rehab, and Perfect Pushing. And let me see.
Impressive.
And I have a corrective connective tissue cream. The purpose is to nourish the connective tissue and also prepare the skin for the taping we do in week 4 of the program. So any practitioner doing my program can teach the program in person, or they can teach it online. I do have an online support program that is given to the people that do the training for their clients. And this program can be done, as I said, in person or online.
Okay, thank you,
Individually or in a group.
Makes sense. Very impressive. So I would like to talk to your work experience prior to inventing Tupler Technique. So what was your work experience like, and what led you to inventing the technique? And I just want to hear in more details.
Well, I moved to New York from New Orleans. I'm not from New Orleans, but I'm from Chicago. So I moved from Chicago to Los Angeles. And when I was in Los Angeles, I was doing vocational rehabilitation for back injury patients. So I was always very interested in back issues. Then I moved to New Orleans. My ex-husband was doing his residency there. And I did several things there. I became a personal trainer. I started teaching exercise. And I didn't work as a nurse in New Orleans. I did some real estate, which gave me a bit of a business background, which I'm happy to have with running my business, because it gave me a good understanding of contracts. And then I moved to New York, and I started working at a health club, and they said, "You're a nurse. Why don't you teach the prenatal class?" Now, this was in 1989, and nobody was doing, I have a little fly in here. I don't know how it got in. I don't open my,
That's fine. I didn't even see the fly.
I don't see it? Okay, I'm just waving my hands. Just, so in 1987, or 1980, I think 1987, ACOG, the American College of Obstetricians and Gynecologists, wrote their guidelines for pregnant women in terms of exercise. So in 1989, not that many people were doing anything with prenatal exercise. So I had to virtually invent what I was going to be doing with pregnant women. And when I was teaching this class, the women found out that I was a nurse, and they started picking my brain about labor. So that's when I became a childbirth educator. And it came to me that you wouldn't run in a race and not train. Why would a woman do the hardest thing she's ever going to do, labor, and not have that mind-body connection, especially having strong abdominals in terms of pushing? So in 1990, I started Maternal Fitness. And the whole concept was preparing women for the marathon of labor. And then I wrote my maternal fitness book. And I had several physical therapists that were teaching my class. It was a 6-week workshop. And we would check for the diastasis in week 1 and then in week 6. And what was amazing was that in 6 weeks, we could make a diastasis smaller as the belly was getting bigger. And one of my physical therapists said, oh my God, you need to get research on this. So she said, contact Columbia. I'm sure they would be willing to do the research. But that was the most astounding effect at all. And I just, 2 trainings ago in my professional training, I trained a yoga instructor, and she was in her 2nd trimester. And I checked her myself, and she had a 6-finger diastasis. In 3 weeks, she brought it down to 3 fingers and maintained that her whole pregnancy, showing that the muscles can stretch really without separating. And she had a great delivery because she knew how to push with her abdominals, relax the pelvic floor. So, so that's really how I got started, was with training pregnant women. And when I first saw this, this fly is definitely wants to be part of this interview here. So when I saw this doming of the abdominal muscles, I thought to myself, what is that? And I started doing research on it, and there was really just that it was a diastasis, and there was really no treatment protocol for it. So it was sort of like trial and error of trying things. And one of the clients that I had was a physical therapist, and she had a very severe diastasis. And she said, well, I'm doing the exercises, I can't feel anything. As soon as I approximated the muscles with a scarf, she said, oh my God, I can feel my muscles working. So the muscles have to be close together to work in a front to back position to really strengthen the muscles and feel them working. So that was how I got started with treating diastasis, was seeing what worked, trying it out on my pregnant clients, and then it just progressed. What I thought, though, was that when I saw that it getting smaller during the pregnancy, I thought, well, gee, if I can make it smaller during the pregnancy, just think what I could do afterwards. So in 2009, I closed my studio down in Union Square, and I decided to become Diastasis Rehab.
Julie, I'm sorry. So the studio was for personal training and prenatal care, or was it strictly for?
It was just it was the Maternal Fitness Center. It was we had pre and postnatal massage, prenatal yoga, we had acupuncture. I had like a whole center.
Interesting.
And then I decided to close it down in 2009 and just train everybody, men, women, children, and expand my market and do the professional training. So,
okay, very interesting.
That's what happened, and then I just started seeing people, individually.
Okay.
I'll never stop seeing clients individually, but my main thrust is training medical and fitness professionals. Yes, and just to let you know, the program has been translated into 6 different languages, and I'm hoping 7 soon to get it translated into French. Right now it's in Spanish, Portuguese, Czech, Danish, Italian, there's one other, and German.
Okay, very interesting. So you have, and the purpose of translation was to offer in different countries, and you have
yes. And so I have trainers in all those countries. In Brazil, I have trainers in Australia, Mexico, Denmark, Germany, Austria, Czech Republic. And I'm actually starting to do a master trainer program where I'm having trainers that have done my program for a year train professionals. Then I'll be part of it. I do a little work with them. They basically use my training program, and they train professionals. It's sort of like the way Pilates does it.
Sure, makes sense. Okay, very interesting. And so the population, so I want to talk about your patients that you still treat, and you treat them mostly virtually now, I'm assuming, right?
Well, I treat virtually, but I do see people. I wear a mask, and they wear a mask, and I do see a few people at my office.
In your office. And your office is in Manhattan now?
Yes.
Okay, very good. And so the population that you service, is it still prenatal population mostly,
No,
or
no,
so all
no.
types?
It's
And
everybody. I
the
get
majority of your patients, would you say, the
the majority of my people, although I've been getting a lot of men recently,
mm-hmm,
which I'm really surprised, but the hernia doctors are referring them to me.
mm-hmm, mm-hmm.
But the majority, I would say the majority are women in their 30s, 40s, 50s.
Got it. Okay, makes sense.
And
Okay.
once somebody finds out they have it, then they look and they go, oh, she has it, she has it, she has it, he has it.
Mm-hmm, mm-hmm, mm-hmm. Makes sense. And then your splint that you mentioned earlier, so is it sold online, or is it sold in different marketplaces? Your
Is it
splint.
sold what? You dropped out there.
This I'm sorry, the splint, your splint that you invented, is it sold online, or is it sold in multiple places in
No,
stores?
it's only sold. I sell it on my website, and all my trainers sell it.
So okay, got
They
it.
have to be trained. I think it was Target had called me about selling it, but I don't want to sell my product that way. I want to, because just wearing the splint isn't going to close your diastasis. People have to be instructed that they have to do all 4 steps, and my
Mm-hmm.
program does much better with
I
support.
see. I
So
see.
I have this
So,
online support
got it.
program that I started in 2018, and I have about a little over 1,000 people on it now. And basically, it has weekly videos, weekly tips, a blog to reach out with others, and best of all, it has a live weekly webinar with me talking about different aspects of the program and answering everybody's questions.
Mm-hmm.
So having contact with me and getting their questions answered really keeps them on target, because they can do the program on their own, or we start a monthly class, an online class at the beginning of each month. So, and there's no expiration date. They can use it as long as they need it. It's sort of like a home away from home.
Mm-hmm, mm-hmm. Very interesting. And so the splint is really an add-on to the program, really, right? So it's an add-on to, to your Tupler program that you offer to the patients.
Well, I don't understand what you mean by an add-on.
It's like, so what I mean is, if patient completes a program, so it will be something beneficial for the patient to use. It wouldn't be beneficial by itself without the.
No, it wouldn't be beneficial, because the whole point of my program is 3 things: is healing this stretched out connective tissue between the
Mm-hmm.
separated muscles. And
Sure.
we do it by repositioning muscles in connective tissue, protecting the connective tissue from getting stretched either in a forwards or sideways direction, and strengthening the muscles in connective tissue
Mm-hmm. Mm-hmm.
so that the connective tissue becomes narrow and strong enough to hold the muscles in a close together position. So
Mm-hmm.
it's all 3 things. Just wearing the splint isn't going to do it. You
Mm-hmm.
have to wear the splint so that the muscles are in the right starting position and connective tissue is in the right starting position to work in the right direction. If your
Mm-hmm.
muscles are separated, what happens is, and you engage your innermost transverse muscle, the muscles move like this.
Mm-hmm.
You have to bring the muscles together in order for them to work in a front to back, the
Sure.
sagittal plane, where they
Sure.
actually get strengthened.
Mm-hmm.
This is not strengthening them. We're
Makes
moving
sense.
in a sideways position.
Mm-hmm. Very interesting. Okay, great. And Julie, so how long is the program that you offer to clinicians, to physical therapists and personal trainers?
So my training program, thank you for asking. My training program is 2 parts. The first part is an 8-week online program. I only train up to 6 people at a time, because I spend a lot of time with each one of the professionals. Like, I spend an hour at the beginning of each week to make sure. However, if they have other questions, they have access to me 24/7. I am there to support them. But I do an hour each week with them. We have an online support program. They have weekly quizzes. They have to put their notes. They have to do the program themselves, plus train 2 case studies.
Mm-hmm.
And
Mm-hmm.
and with training the 2 case studies, initially what they do is they'll put it out on social media. I'm looking for 2 case studies. I'm doing this program. And they'll get so many responses. I had one trainer get like 100 responses. You have to interview the people, but you keep all these people's names and say, when I'm finished, I'm going to do a little free belly check for you.
Mm-hmm.
And,
Mm-hmm.
and that, so you have these names going into the business.
Mm-hmm. Mm-hmm.
So they do these 2 case studies. They see them week 1, end of week 3, week 6, and they take their before and after pictures because they have to present the case studies at the 3-day clinical part of the program.
Uh-huh.
At the home study, they also have to do a video demonstration exam, and they can use their partner or their friend for that.
Mm-hmm.
And then there's 3 days. Normally, the 3-day program is in New York City, but with the pandemic, I've been doing this remotely, with the caveat that at any point in time when everything opens up again, that they can come to New York at no extra expense and do the training program at no extra cost. They would not have to take the written and demonstration exam. They would just
Got it.
view the class. So at the 3-day part of the program, there's 1 whole day of clinic. I do a lecture. We present the case studies, and then we do the clinic where we do splinting, taping, scar mobilization, and checking for diastasis.
Mm-hmm. Mm-hmm.
And then the next day, we do the written exam for 2 hours and then review it. And then we do the Every Belly seminar, where I have the general population come in, and then the trainers are assigned to work with the people
Sure.
there. And so we do that. That's the next day. And then the last day, we do the live demonstration exam. And then they pass it, they get their certificate, and they get like a little emblem that they can put up on their website.
Mm-hmm.
And they can just, I've had professionals just want like I had a plastic surgeon that wanted their physician's assistant just to take the program just for their patients to prepare for abdominal surgery.
Wow.
They're not on the website. They're not. So I have people like that just do the training and then just take it to their practice because they don't want to advertise.
Got it. Got it. Very
And then I have people. So I've trained since 2009. I've trained about 80, maybe 80,
Uh-huh.
84, 85 people.
Got it. Julie, just to clarify, so the second part of the program, in-person one, how many days is it?
It's 3 days.
3 days. Okay. Got it.
Usually
Okay.
we have dinner on Saturday night to get acquainted, and then it's all day Sunday, all day Monday, and then just your live demonstration exam.
Uh-huh. Got it. Understood. Very cool. And for patients, so there's different programs that you offer, and they could be as short as 1 visit and as long as 18 visits. Is that correct? Or how does it work?
No. The program progresses over 18 weeks, and people will always say, when am I going to close it? It's really hard to say when you're going to close it because it depends upon the severity of your diastasis,
Sure.
how large it is, how weak
Absolutely.
your connective tissue is, and your commitment to all 4 steps of the program. So it progresses over 18 weeks, and that's why the program is ongoing, because I still want, if they haven't closed it after 18 weeks, I still want them to be able to access the online support program and keep on doing the program until they close it and have the support. With my clients, when I see them individually, they can just come in for 1 session or see me for 1 session via Skype, or they can do the 18 weeks, which is I see them, they have to watch the video or read the book before they see me. And I see them in the first session, and then in between, they have access to ask me questions. I can Skype with them or whatever. And then I see them the end of week 3 because the program changes in week 4. We start head lifts, double splinting, and the amount of contracting goes up. And then in week 6, what I teach is a diastasis safe workout. Once we've strengthened the transverse, we want to use that with every repetition of every exercise, and have the workout, as I said, be diastasis safe, so they don't undo all the gains that they've made.
Julian, how many sessions per week would it be?
Well, not per week, but I mean, to see me or with what they have to do.
Well, actually, to see you either through via Skype
Well,
or
they
in
see me
person.
week 1, so it's one session week 1,
Uh-huh.
and then the end of week 3,
Got
they have
it.
a little guidebook. So I really only see them for 3 one-hour sessions and then 4 belly checks.
I understood. Okay.
Over 18 weeks.
Very good.
Now, if they wanted more, certainly, you know, I could do more, but I feel that they really don't need me for what they're doing.
Right. So you're right. You establish a protocol that you'd like your patients to follow, and this is what you found the most beneficial to patients. Okay. Very interesting. Cool. And for clinicians, right, for personal trainers or for physical therapists that take your course, what is the price for the course?
The price is $4,000.
Mm-hmm.
And if we do, you can do payments of 3 separate payments.
Mm-hmm.
If you pay up front, then we give a support membership with a 60% discount on products worth a value of like $820. Because
Mm-hmm.
after the fact, if you want to be on the website and you want, you know, the support,
Sure.
it's a membership. It's your option. You can do that. You can have just be on the website and not sell products. You can be on the website and sell products. So I give or you can just take the course and use it and not do anything else. So you have a lot of different options. What you
got
can
it. Okay. And per patient, your the amount that you charge per the 18-week program varies, or is it always the same cost?
Well, no, it's not. What I charge
yes, for your
different
patient.
than what
I understand.
Catherine charges and what the people in Germany.
Absolutely.
They charge what they charge. I probably charge a little bit more because
right. Makes
you know,
sense.
because I'm the inventor. Yeah.
Sure. Okay, makes total sense. Okay, and majority of your patients, they actually sign up for 18-week type of treatment, or
they normally percentage-wise because they get the best bang for their buck. Because if they just do individual sessions, they don't get me in between sessions. They can't text me and say, Julie, this is, I'm going out to dinner. I just had one of my clients text me, I'm going out to dinner with my husband. We're having a date, and I don't want to wear the splint. So, you know, so I text her back, oh, yeah, you're going to wear the splint. There's no question in my mind that you're going to wear the splint. Put your husband on the phone. Get your husband on the phone, and we're gonna have a little chat. So she ended up wearing the splint. She had a distance between her sternum and her belly button. It was 11 inches because she has this pendulous belly. In 3 weeks, the distance went to 8 inches.
Wow.
With like her belly totally lifted up. It was like unbelievable. She said her husband can't even believe it. And she said she has no back pain. And she's a dentist. So she said, and she leans over, she said her back pain is, you know, is just gone. She's like so happy. That was just 3 weeks. I mean, we have a lot more to go with her. So in 18 weeks.
That's great results.
In 18 weeks, you might not, I tell clients, you might not close your diastasis.
Right.
But you're going to look and feel so much better. And that's why I always tell, and that's why I always take the before pictures. And that's why I tell all my online clients, please take your pictures because it will motivate you to continue when you see the changes.
Okay, makes total sense. Very interesting. Yeah, it's great results. And Julie, for the patients, patients that you see personally, is that majority of your work throughout the week, or mostly educating other, clinicians? What takes more of your time?
Well, you know, it depends. Now it's summer and people are away and people, you know, it's warm. So in September, it's depends upon the season. In the summer, it's more about me training professionals and doing that.
Got it.
But I do the training for the professionals. My next one is October 1.
How many times a year is that?
I do it 3 times a year and I train up to 6 people.
Got it.
So that my next one is October, and I have 3 people already registered, so I have 3 spots left. But my attention is really bringing awareness to the medical professionals. That's my attention is that, because I work with a medical supplier, and he was talking to primary care physicians in California, and when he mentioned diastasis recti, many of them did not know what it was. So it's a learning process, and getting people to understand the effects that diastasis recti has on the body. And as people age, it only gets worse. And it's not just pregnant women. Pregnancy is just one of the causes. You can be in a car accident and have that force and separate the muscles. Abdominal surgery causes it, when they blow up the belly or when they cut the connective tissue. Having a big belly from like a beer belly, and also doing crunches can create a diastasis. And also, if you have it and you do the crunches, make it worse. So improper exercise also can create a diastasis. So there's many causes of it. And as I said, and for children especially, you see children doing these crunches, part of the fitness gram, and it's just the worst thing children can do, and which is why I did my belly button boogie video for children, and am talking to pediatric physical therapists about this now.
Julie, so educating clinicians or people in general about innovative techniques and treatments could be very expensive and time consuming. And what did you find helpful to educate doctors and other clinicians on your technique?
The best thing is the internet. So I'll say to doctors, let me do a webinar for your practice. Come during lunch and we'll do this webinar, and I'll give you, and I do like a little PowerPoint, and basically by doing those little mini educational webinars I did it with the Medical Fitness Association, and I do it with different midwife practices, physical therapy practices, chiropractor practices.
And so main specialties, you would say, gynecology type of practices, abdominal surgery type of practices, right?
Hernia. I've spoken at I spoke at the hernia conference in Hamburg last September, and then before that I spoke at the hernia conference in Milan, and basically talking about making a diastasis smaller before hernia surgery to prevent incisional hernia.
And Julie, so I know you're a frequent speaker on American Hernia Society, right? Do you still attend those conferences to bring awareness?
Yes, that's, and I have gotten so many referrals from hernia doctors. It's been amazing. It's been amazing that. So it's been very effective speaking at those conferences.
So Julie, speaking of referrals, it leads me to my next question. So I would like to speak about your patients. The majority of your referrals, those patients that you're treating, come mostly from doctors or different referral streams?
Well, they come when we analyze this, because we analyze the social media. When I analyze this, we get a lot of organic.
Organic, okay.
Organic, yes. And we do, I post on LinkedIn. I'm in the groups there.
Sure.
And I post different little articles and on Facebook and Twitter and the social media. And then, I do an educational series for clients when they come in. I give them the Tupler tips and, put them through the funnel,
Makes sense. Very good.
And, but we do get a lot of referrals from doctors. We do.
Okay, very good. Okay, so mostly social media and the doctor referrals. These are the two biggest, right? And word of mouth, I'm guessing.
And word of, it's. I've been doing this, not over 20 years, but I've been doing this 30 years.
Sure, Julie. For clinicians that take your course, I deal with many different physical occupational therapists and various specialties, geriatric, pediatric, pelvic floor type of clinics. from your observation, or maybe you keep those numbers there, or statistical analysis, what specialty those physical therapists and usually they take your course? Are they in general physical therapy?
Women, no, they're women. They're women's health physical therapists. Women's health. They do because there is a co-contraction between the transverse abdominal muscle and the pelvic floor muscles. So if physical therapists are doing pelvic floor, this is just a natural because the research from Spiedagel shows that it's very important to work them both together.
Very good.
So women's health. So most of I think of most of the physical therapists, it's women's health, and then there's midwives and nurses, and they're also women's health. So that's mostly what the professionals that have done my program.
Got it. So you mentioned there's a doctor, there's an abdominal surgeon that's interesting in attending a course.
You went out again.
Sorry, Julie. You mentioned there's a doctor, like a surgeon, that was interested in attending your course to educate his patients about abdominal surgery and the technique post-surgery. Is that correct?
Yes, I have a surgeon that read my article. It was July, maybe last year or the year before, that I wrote in the surgical journal about reversing umbilical hernia. And he read the article and really connected with it. So he called me up and he said, I really want to talk to you about this. And I have an umbilical hernia. And so he came in to see me and had a huge diastasis. When he came up, the doming, I mean, I could fit over 10 fingers. And this was a problem for him because he was having back pain, and when doing surgery, his belly was getting in the way. So he is doing my program, and he wants to do a study with the VA with something that I have been wanting to do for years. So it's like a dream come true for me, like the universe is giving me this wonderful gift. 15% of the abdominal surgeries that are done come undone. And I think that number is pretty low.
I think that's still a high number, even if it's a true number.
So for people to have to go through surgery and have the anesthesia, and then to have the surgery come undone. My physical therapist on the Upper West Side had a tummy tuck, and it came undone, and then she did my program. But with a tummy tuck, you're getting cut from hip bone to hip bone, and that is like a very horrible scar that has to be mobilized because anyway, so he is wanting to do a research study about preparing patients before abdominal surgery, and I know that this is going to make such a big difference. And he says, if I can bring the muscles closer together, I'm not going to have to use the mesh. The connective tissue is going to be strong enough to hold the stitches, and the patient is going to be able to know how to use their abdominals in the recovery process to maintain the integrity of the suture. So when they know they're going to have the strength and awareness to use their abdominals, so when they stand up, they engage their muscles and then stand up so that there's no force on the stitches. So he said he's submitted the initial papers to the VA, so I'm keeping my fingers crossed.
Okay.
And of course, we'll do anything to help with the study that I can.
Sure. That's exciting. It's really exciting. Okay, Julie. So my last question here: what is your long-term goal for Tupler Technique and the Diastasis Rehab?
Well, my long-term goal, since my lifespan doesn't continue on continuously, is that the Tupler technique survives me, and that I have enough people out there doing the training, so that people have that. And I'm hoping to join forces with, especially with the surgical part, with insurance companies, so that just like preparing for shoulder and knee surgery, the insurance companies will want the doctors to have their patients prepare for abdominal, the prehab abdominal surgery, my ab rehab program. So the big picture, that would make me so happy. And the big picture also that doctors and fitness instructors check people for a diastasis. I hear over and over and over again. I just heard another story. The lady goes from doctor to doctor, has test for test and surgery, and not one person checked her for a diastasis. And they give them pills for depression because they can't figure out why they're having the back pain, why they're having the bloating. They've tried to, they've gone on this diet. Nothing has stopped the bloating because their muscles are separated in the connective tissue. So when they eat, the organs move forward. It's just
makes
so
sense.
So it does make sense. So I would love that every belly were checked as part of every medical and fitness evaluation. So I guess I have a lot of long-term goals.
No, these are great goals, and I actually think prehab, having it as part of prehab is great, and it should be part of prehab and covered by insurance, because it's going to save insurance's money.
But also prehab for pregnant women. If a woman has a C-section, her muscles are, so if this is my uterus and this is my cervix, the cervix needs to be lined up with the vaginal canal. When the muscles separate and the connective tissue stretches sideways, what happens, the uterus tilts forward. So when the uterus tilts forward, the cervix is now pointing sideways instead of downwards, and that's why you have to have a C-section, an unnecessary C-section. Keeping the muscles together keeps the uterus in place, keeping the muscles together and strengthening them and teaching women how to push with their abdominals and relax the pelvic floor is the best thing that they can do to prepare for labor.
Absolutely.
So not only will they have a better pregnancy because they won't have back pain after the birth, I tell them, if I don't get you on the benefits of being able to push with your abdominals, relax the pelvic floor to prevent prolapses and hemorrhoids and incontinence, I'm going to get you on the vanity, because the abdominals look so much better if they do the program during the pregnancy. It makes such a big difference.
Absolutely.
Their abdominals just, because they're stretching, but not separating if they do my program.
Okay.
So it's before, during pregnancy would be great, and before abdominal surgery would be great.
Makes sense. Totally. Okay. Julie, thank you so much for your time. It was very informative.
My pleasure. I could talk to you all day and all night about this.
I mean, I'm glad that I know more about the program now. Like I said, we have clients, they do specialize in pelvic floor, physical as well as occupational therapists around the country, and it's a great course to recommend them.
Well, thank you. I would appreciate that, and there is an info packet that they can download from my website. And
beautiful. This
love
is great.
to talk to them about it and Skype with them.
All right, Julie. Thank you. I'll speak to you soon.
Okay. Thanks for having me.